Hello and welcome to the intervention presentation and capstone video reflection for Nursing 4900 Capstone Project for Nursing at Capella University. My name is Brandy Turzin and I will be detailing the hypertension video presentation to patient RA along with reflecting on my experience in my journey through Capella University's RN to BSN program. The goal of the capstone was to develop an intervention to improve self-management in hypertension so that RA, our patient, can manage his disease on his own. The summary of the patient. The focus of the intervention is RA. He is a 8-year-old white male who has been living with the diagnosis of hypertension for around 2 years. RA is 5 foot 8 inches and around 200 pounds. During a recent checkup at his primary care physician, his blood pressure was found to not be well controlled. He had 4 readings done that day in the office, and they were all in the 170 to 180 over 90 to 95 range. RA had been prescribed metoprolol 50 milligrams by mouth twice a day around 2 years ago. RA admitted that he knew his hypertension was not controlled, and also he had not been consistently taking his medication on a daily basis, let alone twice a day. RA also admitted he was struggling to eat a healthy diet, and also physical activity was an issue for him related to his spinal fusion surgery he had around 4 years ago. The intervention comes from my meetings with RA on several occasions in late October and early November of 2021. We discussed his hypertension diagnosis and his goals related to getting his hypertension under control. We met for a total of 11 hours. We discussed areas in which he felt he needed education and improvements and his desired goals and outcomes. RA also expressed an interest in doing whatever he needed to do to live a long life for his grandchildren. He stated the understanding for him to be an active participant in his disease management. Contribution of my interventions to patient satisfaction and quality of life. After assessing RA's needs, I developed an evidence-based intervention. This was to implement a patient-centered care coordination plan, including education on medications and their management, diet and exercise information, and education on lifestyle behaviors that can positively and negatively affect hypertension control. Also included were community resources available to RA that could be beneficial to him in his disease management. I also emphasized the importance of frequent monitoring and routine follow-up care with his primary care physician. We reviewed RA's current medications for hypertension, metoprolol. We discussed using medication reminders, pill sorters, and the importance of following his medication regimen every day and being consistent. RA expressed verbal understanding of this portion of his plan and his ability to maintain it. Diet was another topic of concern for RA. We identified the needs for this based on my meetings with him. He admits that although he tries to be quote-unquote good, he often eats unhealthy food and not a lot of fresh fruits and vegetables. He also admitted he does no tracking of his sodium intake. We did some teaching on things that would be beneficial if he added to his diet and things he should avoid and or cut out of his diet. Part of my care coordination was to set RA up with a nutritional consult to have a more in-depth conversation of what a daily diet would be like for RA. RA also had concerns regarding his exercise plan. He felt that he had limited ability for physical activity related to the spinal fusion surgery that he had 4 years ago and his physical limitations due to that. We discussed his ability to do short walks and maybe lap swimming at his local YMCA. We also set up a PT-OT evaluation to get a better idea of his physical limitations and also safe and approved exercises for him. I met most recently with RA after he had been about a week and a half into his implementing of his plan. Though he was just beginning, he seemed to be more comfortable with how things were going and had a confidence when talking about his activities and changes he had begun to make. He admitted he had not yet accessed any of his community resources, but did plan to. I also encouraged him to do so. He also stated that he and his doctor did discuss a plan to use a mobile health application to communicate his blood pressure readings remotely, which can also assist in closer monitoring and tracking of his blood pressure. To research hypertension and develop the intervention, I used evidence-based peer-reviewed articles. Peer-reviewed articles have been written and reviewed by experts in their topic, making them an accurate resource. Evidence-based refers to making decisions based on the best available scientific evidence and providing patients with efficient and effective care. These two combined provided the framework upon which I built interventions for RA on. Using credible sources within 5 years also assists in the most reliable resources for research. Opportunities to improve healthcare technology. Technology has been beneficial to our daily life in many ways and is always improving and updating. In healthcare, advancements are made every single day, allowing patients to access to care. For RA, using telemedicine appointments to discuss his care and monitoring, along with medication adjustments if needed, all done at home without having to make a trip to the office. Technology is also allowed for the use of mHealth applications, which can turn your phone essentially into a medical device to be used for monitoring blood pressures from home and communicating it to the physician. This allows for closer tracking and monitoring and improved overall control of his blood pressure. Health policies and impact. In making a care plan for RA, I need to share information with other members of his interdisciplinary team, making awareness and education on the Health Information Portability and Privacy Act, or HIPAA. It is useful as it guided me in protecting RA's protected health information and maintaining his privacy when sharing it with essential members of the team. The Affordable Care Act is also a policy that has had an impact on developing a patient-centered plan. The Affordable Care Act made health insurance available to all regardless of pre-existing conditions like hypertension. The ACA also has a focus on community-based prevention programs, which can serve as a great resource to patients in need of care for preventative care or the diagnosis of hypertension. The ACA has transformed the roles nurses play in the care coordination for their patients, using a patient-centered approach that involves many members of an interdisciplinary team. As a baccalaureate prepared nurse, it is my responsibility to be involved in the development and making of policies related to the unit I work on. We are continuously updating and improving policies, and with my experiences here, I could feel more confident in this role at my current employer. Capstone project outcomes versus my predictions initially. Upon initially meeting with RA, I thought he may have a difficult time adhering to his plan based on his past behavior and experiences. After meeting with him, I felt the sincerity and motivation expressed and his desire to meet his goals and achieve control of his hypertension. When seeing him achieve small goals in less than 2 weeks into his intervention, I was surprised at his ability to take control of his disease management. I was excited to see him utilizing the education and interventions I had provided him as a resource. My personal and professional growth throughout my capstone project and the RN to BSN program at Capella University. The capstone project allowed me to follow a patient through an intervention that I designed and developed from start to finish, and I was able to see the improvement in RA even early on, based on the interventions that I had given him. I've learned that the value of active listening and maintaining the principles of the Nursing Code of Ethics as a guide in the care of my patients and their families can improve outcomes in their care. I feel confident I have provided RA with best practice intervention. I took the time to research evidence-based data, providing my care based on this type of research. Being in the Capella University RN to BSN program has taught me things in nursing I had not yet understood. Things like care coordination, research skills, and higher level decision making as a baccalaureate trained nurse. I have never written a policy, but feel that I can do that with comfort now after the research and planning I have done here at Capella. There are aspects of nursing care that I have not yet explored, but feel I may be able to using the resources and proper collaboration with the healthcare team. This program allowed me to grow in my profession, and I look forward to future opportunities to use some of the skills I have developed here. I have always enjoyed teaching others, and with Capella University, I have found a way to do so and feel empowered to explore roles as an educator in the future. I have been a nurse for nearly 20 years, and I'm proud to say I have finally achieved the goal of obtaining my bachelor's degree in nursing. This program allowed me the flexibility with my busy work, family, and life schedule to complete it at my own pace, and that made all the difference in the world to me. Thank you for listening and have a great day.